on the screen, healthcare in between, physics, art, and math, guide us down this path. Historical tales come alive, where science and stories dive, blended facts with heart, knowledge from the start. Meet rich blues we sing, to the future memory, health and science in the mix, Meet got the fix. Complex subjects made
right
clear,
now
every episode
in ways that we actually acquire
leads the way,
and ways that make me more efficient.
in the world of digital streams, turning knowledge into dreams, through the tales of old, new stories unfold.
Thank you so much for joining with me. It is a truly an honor and a privilege.
MedBix Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming.
Hey, welcome to the MedBix Webcast. This is Ramana Annamaraju. I'm the host. I've been doing this for a while. I want to tell you, the last week I went to Minority Health Institute, and I want to show you a little bit about that. The conference I went to. Dr. Richard Allen Williams is the founder of that Minority Health Institute. He's also founder of Association of Black Cardiologists. So I went to Los Angeles for a conference. It is really fascinating. I want to show you just a couple of pictures. And, it's really a lot of educational and understanding their fears, their aspirations is always beautiful. Okay, let me show you why I want to show you that. And then after that, I will come back and introduce you. So this is Dr. Richard Allen Williams on the left side. Is a founder. He's also founder of Association of Black Cardiologists. He's the first Black doctor who went to the Harvard, and then became a cardiologist actually. So he's been here in the 90s. He's still doing very well. His mind is sharp as like anything else. In the middle, that is Dr. Diana Ramos. She's a California State Surgeon General. So that is the president of the next one is on the top is the president of Dr. Carla is a very well-known Charles Drew Medical School president. And then one of my good friends, Dr. Carol Watson. She's a Barbara Streisand Heart Program. She's a director, cardiologist. She is a big speaker and NIH. She does a lot of work in the NIH. So these are the prominent people I met, and I had a lot of good time. But anyway, so I wanted to just, tell you that's the journey that I had. But anyway, that now, all the voices we need to hear, particularly I have a great soft corner for nurses in general, because they are the first contact for all the patients. They are the ones who listen, care. They don't strike you as some crazy stuff or, they have all these emotional things, psychological. They listen to you. They are the first to contact for all the patients. So we need to treasure them. We need to listen to their needs, their respect. And so, one of the things is nurses burnout is one of the things came in there during the pandemic, after pandemic even. So these are the things we need to, there is a case in Tennessee when I was in Atlanta. There's a big in the national news, and we'll talk with the upcoming guest. The upcoming guest is Dr. Beth Sanford. She is in North Dakota. She's joining, I never interviewed anybody from North Dakota. She got that special recognition. North Dakota, she's coming from North Dakota. She is a doctor of nursing practice. And then she does a legal medicine. So the legal medicine means quantifying, to non-medical people, explaining the jurors, for example, what is that outcomes should be, what their mistakes they made, anything like that. They could explain that in a more quantifiable terms of the abstract subjects. The second one is she is also the speaker, and then she's a vitamin D expert. Vitamin D, I don't know much about it. I hear a lot of news about it during the pandemic. Everybody's talking about vitamin D. Let us talk with her about that. And then she's the president of the North Dakota Nurses Association. So it's a really, she's an honor to have her. Let me bring her to the table. Welcome, Dr. Sanford. Welcome to the MedBix webcast.
Thank you.
Tell us a little bit about your background, how you, just until the personal background, briefly, if you don't mind.
Sure. Yes, so I've been a nurse for almost 30 years. And for the last 20 years, I was living in Asia for about 5 years of that time. And then moved back to the US, moved back to my home state of North Dakota. And for the last 15 years, I've been working mostly in nursing education. And then I went back to school in 2021 and got my doctorate of nursing practice. And so I'm still working in education, working more in health policy. It's just really fun to be in nursing education and then also working as a legal nurse consultant. I have my own legal nurse consulting firm. And so I just get to work on the bookends of nursing. I get to see nurses from the very beginning until at the very end when I'm working in legal cases and everywhere in between, working in health policy. So it's a really fun space to be and just to get to impact the world of nursing.
Let me ask you a question on the why you were interested in the understand the healthcare policy, because you travel around the world. Legal medicine is a very outside, and vitamin D, you focus on vitamin D. Let us talk about vitamin D first. What is that interest to you, vitamin D part of it?
I actually became really interested in vitamin D when my daughter had severe vitamin D deficiency and became really ill. And so then I learned about the consequences of that and how that affects people. And so it really inspired me to start digging and learning and growing in that area. And it took me a couple of years, actually. The reason that I decided to get my doctorate actually was because I wanted to do more research on vitamin D and look at how do we educate healthcare professionals about vitamin D. Because what I realized is healthcare professionals are not very informed on it. And maybe the knowledge they had is something that they learned when they were in school many years ago. And so they are not up to date with current science and current practice. And so that was my passion. My passion, stood about 5 feet 1 inch tall. It was my daughter. And so I saw somebody with a joyful, bubbly personality turn into she was just so ill. And so her immune system was so poor. Her mental health was so poor. And then to see that decline and then to see her improve so quickly when we addressed her vitamin D serum concentrations, it just is such an inspirational story, and then I started looking back at my own health journey and realized that, wow, I was probably very vitamin D deficient when I was pregnant. And so then that impacted I really know a lot about vitamin D in a lot of different areas, but my specialty and my love is really maternal health and vitamin D. And my hope really is to impact maternal morbidity and mortality globally through vitamin D education.
Let us talk about that a little bit. So maternal mortality is connected with the vitamin D. Is there a deficiency there? Is there any connection between these two? Maternal mortality?
Oh, yes.
Tell us a little bit about that.
Well, the research is just so fascinating. And there, I actually was diving into it today because I'm writing an article right now, co-authoring with some women from other parts of the world. And it's just so fascinating to me that when we look at something as simple as sunlight exposure and vitamin D serum concentrations, how it can put women at risk for so many things. And then in the maternal health area, specifically things like preterm birth, preeclampsia, gestational diabetes, hypertensive disorders in pregnancy, all of these things, vitamin D can have an impact on those health concerns. And so for me, being a woman at the time that I was pregnant, living in a northern latitude where I wasn't getting vitamin D exposure, vitamin D from the sun 6 months of the year up at the latitude where I was living. And then at that time, I was really hiding from the sun. And so between those, in that critical time period of the day when you can generate vitamin D, I was worried about aging. So I was taking on the sunscreen and going back in the house between 10 and 2 because I was so concerned about aging. that then I put myself at risk for very severe vitamin D deficiency. And then I did have some high blood pressure during pregnancy and had some symptoms, was on bed rest, retained a lot of fluid, and was very, very ill and had a postpartum hemorrhage. And so, so my own story and the story of my daughter really inspired me for what I'm doing today.
It is particularly relevant nowadays because the maternal mortalities in the United States is not small number. It is almost very high compared to any industrial country. So let me ask you, this is a vitamin D is a sunshine. If you go get the sun, you get that. That's how everybody knows. But a lot of people, particularly white Caucasian race, worried about skin cancer and skin longer exposure to the getting looking old, as you said, wrinkling. So how do you solve that? How do they balance out that process?
Yeah, I think it's really, again, about balance, right? I think for many, many years, we really educated people about the dangers of excessive sun exposure causing skin cancer. Of course, people who are more fair skin tone like me are more at risk. But most of the skin recommendations around the world were based on the really, really fair skin. Just recently, Australia came out with more culturally relevant recommendations where they recommended based on the person's skin tone. And so I really encourage people to take a look at those Australian guidelines, because that is the first nation in the world to have culturally competent skin recommendations for sun exposure. And it was really exciting for me as somebody who's a vitamin D advocate, is that when I'm talking to people, like, for example, in North Dakota, just because of global migration, we have large communities of people now that are from other places in the world, that are from locations around the equator. And so them shifting latitudes up to the way north is they don't have the same opportunities for sun exposure, as they did in their home country. And so we really need to be thinking about special populations that maybe have moved into our, for my case in my state, to do that education for those communities, like the Somali community, for example, or the Nigerian community, the Iraqi community, other communities that are used to more that equator sun, now moving up to the far north, very much changes in what they need to do for their sun habits. And then to understand about that we don't get UVB rays for 6 months of the year in North Dakota. So we can't generate our own vitamin D for 6 months of the year. So that really impacts our vitamin D risk.
You made a very interesting comment. There's some people like us, like me, who moved from India to northern. I lived in Montreal for a while, Canada. So there's nothing much. So it's actually the place you stay, and then the race also affects. The combination of these things can cause the deficiency of the vitamin D. That's what you're saying. And there are guidelines by Australian guidelines. What they recommend, is it if you're a doctor more, or what is just can you give us a glimpse of that guidelines?
It's really the recommendation of course, for the more fair tone people that you don't want to burn. Right. And so, there are people that are more fair than me. So they need to really acclimate their skin from winter to spring to summer so that they don't burn. Really, sometimes even the fairest people, we say, start with your feet. Right. And really just 1 minute, 2 minutes, 3 minutes, 4 minutes, really gradually work up their tolerance to the sun, so that they don't get burned. Because of course, burning is what leads to most skin cancers. Now melanoma is a different type of skin cancer, which is typically in areas that are covered by the body. And there is some association with vitamin D deficiency in melanoma. So we want to make sure that people understand that we need some exposure. Now, the darker skin tone. So of course, we have every color of human skin under the sun, right? The darker your skin tone is, the more time you need in the sun to generate adequate amounts of vitamin D to support your vitamin D serum concentrations. So for my friends that are, Sudanese, right? They're very, very, that rich skin tone. They need more time in the direct sun to generate the same amount of vitamin D that I would. And the range can even be up to, 15 minutes to 90 minutes to generate the same amount of vitamin D, depending on your skin tone. So that's really something that's very important, even for healthcare professionals, to know when they're giving sunscreen recommendations, that they're really looking at those Australian guidelines, which are the most scientifically current.
Interesting. You said that actually if you're a doctor, the more you need more sun exposure. But let me ask you, there is a milk is the biggest source of vitamin D. They say they advertise on the milk carton. The vitamin D fortified. Does it make
Yes.
any difference? These are all. What are the other food items that add up the vitamin D? Vitamin D.
So there actually was a group that did studies on this a few years ago from Canada. And what they found was that actually fortified milk is a very low source of vitamin D. You'd have to have almost 100 glasses a day to achieve the necessary vitamin D for a 150-pound adult, for example. Now, for pieces of salmon, for example, you would need probably around 5 pieces of salmon a day.
Oh
And
my
I don't know about you, but I can't afford to eat 5 pieces of salmon for 5 servings of
Oh my
salmon a day.
God! First of all, you cannot
I
eat
want
that
to.
much food.
But yeah, so foods, even naturally occurring foods like egg yolks and salmon are not enough to have a person have a robust vitamin D serum concentration that's going to support overall health and wellness. It is supporting, but the number one source where people get vitamin D is from the sun. And so that's why we need that time outside, because food can't make up the difference. UVB devices can also support vitamin D serum concentrations. But again, the Canadians have done a lot of research on that. It is effective in increasing vitamin D serum concentrations. But again, you have to monitor so you don't burn, right? And then, of course, supplementation will also increase vitamin D serum concentrations.
Let's talk about the testing, Beth. The testing it's very complicated testing. What I understand is how do they test it? The vitamin D deficiency, and is it covered by insurance? What is the status on that situation there? Vitamin D testing.
Well, now we can get vitamin D tests on the internet and over the counter. So you can get it by a finger poke. You can get it by a blood draw. Actually, vitamin D tests themselves are not expensive. I asked a director of a lab one time, just talk straight with me. I said, how much does it actually cost to do a vitamin D test? He said, probably like $5. $5. And so this is really a point for advocacy, for advocates, is that most systems, healthcare systems, charge $300 to $600 for a vitamin D test. So it really is cost inhibitive for people to really be able to stay on top of what their vitamin D serum concentration is. Yeah. Now, if I had a thyroid disorder, my doctor would make sure that I had a thyroid test so that I could have my thyroid, that I could receive my medication so that I could keep my serum concentrations within that normal range. And thyroid panels are very affordable. You can get thyroid panels some places for $15, $20. Why are vitamin D tests $300 to $600 when it's really the same situation? Is that I need to be able to know that I'm keeping my serum concentration within the acceptable limits of normal. And so I don't really understand that, other than I really don't understand it. I think this is a huge point for advocacy. And it's really a key point for reducing maternal mortality and morbidity in the U.S. as if we can advocate to lower the cost of testing for those vitamin D tests and make it the norm that we're testing 3 times in pregnancy. In first trimester, just to get that initial lab, we're testing in the midpoint of pregnancy, and then we're testing in the 3rd trimester so that we're obtaining and achieving those 40 nanograms per ml that's demonstrated to have those great health effects for the baby and the mom.
When I was growing up in India, my father used to give me B complex. It's like a wonder medicine, and everybody gets it. After anything, if you go through infection, if you go through anything, just get the B complex after that. Now, during the pandemic, we had about same thing about vitamin D. It's a wonder drug. It can solve a lot of problems, even prevent the COVID, and there is a controversy also. There is a lot of controversy came after. But even the controversies, they're not really bent completely against it. But Scientific American wrote an article about it, and they said that it's a little bit of hype about it, but it has a lot of benefits, and it stops the rickets for children. There is a lot of benefits for that, and let me understand your take on that.
Well, I always find it interesting when people try to say that there's a lot of hype about vitamin D, that it is not effective, because I think it's kind of common sense, right? Our ancestors were people of the sun.
Yes.
They lived outside, they
Yeah.
spent time outside, they lived a traditional lifestyle. If we look at vitamin D serum concentrations of people who still live a traditional lifestyle in Africa, their serum concentrations are roughly between 40 and 60 nanograms per mil.
Yeah.
That's without any supplementation. And they're actually hiding from the sun sometimes. They're not trying to have excess sun because it's hot, right?
Yeah.
Their naturally, their levels fall between 40 and 60.
Yeah.
I mean, if we look at lifeguards who live and work outside, and construction workers, preliminary data I've seen shows their average serum concentrations are right around 50, between that 40 and 60 nanogram per mil mark. Pregnant women in Africa, their average is 55 nanograms per mil. So I don't understand why people are afraid of having robust serum concentrations, right? Yeah. And then, so from some of the people that have talked to me personally that maybe have been a little bit critical about vitamin D, one of the key things that I've found that's in common with them is that they don't read the research, or that they don't know how to read research. Because one thing is that, I know from nursing school and from what I've heard from most of my medical doctor friends is they actually aren't taught to read research. And then reading nursing nutrient research is, again, something all of its own. It's not a drug, right? So designing it like a drug trial doesn't even make sense. It's a nutrient. So we have to have a nutrient design. And actually, there was a scientist named Robert Haney who made the Haney criteria of nutrient design to design nutrient studies, because it's different. We get vitamin D from the sun, we get it from food, we get it from supplements. So we get it from sources other than the supplement. So that's why you have to mark those studies with serum concentrations. And so really what it comes down to is vitamin D really is all that. We are meant to be people who are out in the sun. And when we're out in the sun, we're healthy. Look at the sickest people in your life, and it's the people who are stuck indoors, right? Or who choose to stay hidden indoors. People who are outside, exercising, walking, spending time out in the sun, living, they're healthy.
That I have a good friend of doctor. His name is Dr. Jelligam. He recommended me very high dose of D3, the vitamin D. I really believe in it, because my memory improved, and also, those kind of things really, it has a very powerful. We need advocacy and also teaching. A lot of doctors may not know all about good things about vitamin D. I think there is a need for education, particularly if it is stopping the maternal mortality. It's a very essential. Now you wear a different hat, Dr. Sanford. One is that hat is a legal medicine. I'm always fascinated. I always know the doctors giving. I used to work with a lot of doctors. Sometimes such. Giving them a certificate, legal expert witnesses, all those things. I've seen that. So tell us what is the legal medicine is, where exactly it plays a role.
So I work as a legal nurse consultant. So one of the things that I do, and that legal nurse consultants do around the country, is that we look at cases for merit. So we maybe look at the medical records, look over the case, look at it with our nursing eye, and see, does this case have merit? And we give that recommendation to an attorney. So we work through attorneys. We work through a law office. We don't work independently of law offices. We are a consultant to the attorney. Another capacity that legal nurses can work is as an expert witness. So, for example, if we have an area of expertise working in some area, like, of course, one of my areas is looking at nutrient deficiency, looking at particularly vitamin D deficiency in pregnancy, and looking at maybe was that a possible contributing factor to maternal morbidity or maternal mortality, right? Or even neonatal morbidity or mortality. So that would be one of my expertises in nursing. Another one is I worked in long-term care for many years. And of course, being a nursing professor, I've worked in mental health. So I can be an expert witness for some of those things. So then we can testify to the nursing care in those cases. I think it's really kind of that space that is, we bridge the gap between the legal system and the medical system. And like nurses do, we're good at educating, right? So we're good at educating the legal team as well. Like, this is this because of this, right? And I really enjoy being a legal nurse because I'm a teacher, right? My heart is a nursing educator. I'm good at educating, so it helps me in a good way to be able to explain, okay, this is how the progression of events happen, within my realm of expertise, does this case have merit? And it's actually really fun. I helped about 10 years ago, I helped with a few cases, and that is what really made me interested in doing legal work as a side gig. So it's kind of my side business right now, and I love it. I think it's really fun.
But actually, let me ask you a different way. There's actually nurses become victims. One of the cases that I followed in Tennessee, Nashville, the woman in Vanderbilt nurse got prosecuted. Thank God they didn't put her in jail or anything like that. But she gave a wrong medication, patient died, and then they blamed her and they prosecuted her. In fact, that was terrible. I mean, the system is not responsible. The systemic problem that is not a health problem. So nurses burnout is one of them. It is actually, when I get back, I'll ask you about that. Then after that, and how they reach you and how can you teach to other people. A lot of doctor friends of mine is interested I wanted to bring you. I want to bring you on the side, and then we'll work together. You can jump in anytime. I'm going to present a topic. That is Dr. Beth Sanford, doctor of nursing practice. She is a speaker, vitamin D expert, legal consultant. That is a really amazing. So I'm going to talk about a little bit about a woman, extraordinary woman of similar caliber, probably like Dr. Beth Sanford. She is one of the prominent figures in history. I'm going to talk about her. Now, the story starts here. So that is Dr. Beth Sanford. She joined from North Dakota. So when I get back, we will ask her questions about the nurses burnout and the education teaching part of it and the legal medicine. We'll ask her a little bit about that, how we can reach her. So let me tell you a story about this completely a warrior in the medicine. Alexander Litvinenko is a former KGB agent. What he did was he defected to London, and then he was invited. After a while, he was invited by his friends to a cup of tea in the Hotel Millennium in London. He consumed the tea, and then within a short period of time, within days, he looked like that. Hair loss, nausea, vomiting, and all those things. He's just a former KGB defected to the West. He became like that. So it was a very tough. Doctors could not understand the diagnosis. Eventually, they find out that maybe it's a poisoning. There's the radiation poisoning. So they thought that when he consumed the tea, he must have had that some kind of a radiation poisoning that he had. So they tested. What they did was usually when you ingest tea or coffee or actual radioisotope, the radioactivity doesn't go outside of the body. It just destroys the body inside. So they have to catch it. They have to test it. What they did was they dropped a silver plate in the stomach and then see alpha particles that measure the Geiger counter. I'm a nuclear physicist. So Geiger counter, they use it to measure the radiation there. They confirmed it's a polonium. They used it. Somebody put the polonium in the tea. This is not an accidental. It cannot be accidental polonium because it's a very highly regulated. It's ultra manufactured. So the investigators went to the teapot. Still, the radiation is on the teapot. The teapot in the Millennium Hotel, that is still ting, 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 is buzzing with the teapot, with the radiation with alpha particles. So the same guys, these are the spies from Russia, came to kill him. That's what it is. The two guys came down from Russia. They came from State Airport. They followed all the way from the airport to the teapot place in Millennium Hotel, and then after that they went to sushi restaurant. After that they went to they said that you need to look like a normal people in that country. So they went to the lap dance strip club, and then in the strip club. So even that is the Geiger counter noticed all of them. It is a wonderful, it's a deadly track they followed all the way to the. It is the only way it is possible is that it is has to be approved by the highest authorities in Russia. That's why they think there are a lot of people. London blamed Putin. Putin is the cause of that death. That's what they said. He died within 2 weeks. He died. Alexander Litvinenko died. So that is the one story. I'm going to give you another story right here in the United States. Radium girls used to call 1917. You know, my when I was growing up, I used to have a clock that like that. You know, in the nighttime, you don't need a batteries. You can see the time in the round the clock. These are painted the radium isotope. The radium was painted radium liquid. They paint on the numbers. They radiate. So these are radium. This is the owners of this radium corporation. What they did was they had a bunch of girls, and then they said that, you know, lip dip and paint. You know, they take a lip and then put the paint on the numbers, and then it looks much more clean cut and aesthetically, cosmetically good. So all of them they were doing in 1917. And what happened? Something says, even though a lot of scientists warned about that, they didn't care. They thought, oh, it's a lie. It's nothing is there. So all the women, they call the there is another guy that during the time, there's a golfer wanted to say, he wanted to have a sexual, you know, improve the sex part of it. He got the radium water they used to buy for $1 to improve sexual performance. Then he died immediately. But anyway, the radium jaw, these girls were suffering unbelievable suffering. They have the radium jaw. Is a necrosis, a depth of cells there, lower and upper jaw bones, and then it's a beautiful woman shaped into the, you know, is destroyed their figures. So they sued the Radium Corporation. You know, no lawyer wants to take their case. There is no Beth Sanford's there at the time. We need people like her. So
I would have taken that case.
Yeah, we are taking the case.
If I was a lawyer.
Yeah, you're a legal nurse also. You could have advocated that one. So nobody was taking it. They eventually one guy, wow. And then they got $10,000. Even at that standard, that even if you extrapolate, is not much. So they got $10,000. All these girls who sacrificed their lives, you know, horrible figures became deformed. In fact, so the Radium Corporation eventually closed it. Everybody. That was the. But the deadly poisons, these are radium, these are two, radium and polonium. Polonium, they use it in the death of a spy, and radium, this necrosis of dangerous materials, was invented by a very soft woman, really down-to-earth woman, Maria Salomia Curie, Savlaski Curie. Her name, still I have a hard time say her name. My name is also difficult. But Mary Curie, she was born in 1867. So she was born in Poland. What she did was, at the time, girls were not allowed to study science or math or anything. So they were in the flying university, they used to call. Secret gatherings. Girls used to go underground and study together. So the people come and teach them home study, basically, you know. So she studied there, and then she really got very good degree. She passed a lot of exams. And then she was recognized and she moved to University of Paris. But even though they recognized her talents, they gave her a potato shed. Oh yeah, she said that I can do something about the radiation, radium isotopes, all those things. So they gave her a shed at the time. It's a Curie lab, it's called. That is a real shed. So outside of the University of Paris, outskirts of the University of Paris. So what she did was she took a pitch blonde, and then she took a huge amount of this, go to the ore, and then pitch blonde, and then she attracted through acid, she attracted, crystallized it, and she separated the radium isotope from there. Radium is a radioactive material, so that is what she did. So then during the same time, there was a World War I broke out. It's a 1.3 French. The Germany invaded France. 1.3 French were killed. 1 million injured. It's a brutal war is going on at that time. But Mary Curie, he wanted to, go against Germany, and then she did not invent the X-rays, but she designed first mobile X-ray unit. That is the actual X-ray unit she designed. It's a mobile X-ray unit. She designed the first X-ray unit, and then the first picture that is taken of the hand accidentally on the left side. Right side is the first bullet in the World War I. They took the picture of the X-ray. Right side. So Mary Curie was driving herself. She was a woman's man, man's woman. All both ways. She is an extraordinary. So she went there. We can save these soldiers who are hurting and injured in the bullets. We can save them. Give me. I can build these mobile units, X-ray mobile units. And she asked the generals, French generals. They dismissed her. She's a woman, and then she wants to build this engineering thing. They dismissed her completely. But she never took no for anybody. She went into she is a feminist, a true feminist. She went to the Coco Chanel. Coco Chanel is a fashion designer, famous fashion designer. All the Parisian woman, very rich woman, gave her a lot of money. So they built They did 20 mobile X-ray units. They built it through the money from the Parisian woman. This is a woman's first undertaking of the X-ray. So they did that, and then really tried to save lives in the less petite, they call mobile X-ray. She was actually, what she did was she hired a lot of people. She hired 20 women operators, not men. She's a feminist, true feminist, and her daughter is one of them. So she trained as an X-ray operator. Irene Curie is her daughter. She trained her. So eventually Mary Curie was awarded Nobel Prize, twice in fact. One for physics, sorry, discovery of radium. The other one is isolating the chemistry of the radium. Sorry, today was so she was awarded 2 Nobel Prizes. There is no other person got the 2 Nobel Prizes, no other woman so far. So, but the second Nobel Prize was a controversy. Her husband died. She was having an affair with one of the persons. After her husband died, she was having an affair with one of the lab assistants. At the time, all the French press said that she should not go to. She doesn't deserve Nobel Prize. She should not be in the media. She should not go to Switzerland, Sweden to get the Nobel Prize. Then Einstein wrote a letter to her. That is a really good. If you have to read that. If the rubble continues to occupy itself with you, then simply don't read that hogwash, but rather leave it to the reptile for whom it has been fabricated. Beautifully said. Albert Einstein wrote a letter to her. Don't even ignore this all nonsense. They're all people talk nonsense. So he is a really rock solid guy for her. So she is her daughter. She is also, on her own right, she's a very famous scientist, and she is artificial radioactivity. You don't have to be naturally finding radioactive materials. You can really make it by bombarding radioactive things on the materials. Technetium, iodine, we use in Dr. Sanford may know that they use in the bone density and other places in the PET CT scans. These kind of things, stress thallium, they use this kind of a contrast agent as a contrast agent. So X-ray, Irene Curie did a lot of these contributions. So the whole family got the Nobel Prize. Mary Curie got the Nobel Prize. Her husband got the Nobel Prize for the discovery of radium, and Mary Curie got the second Nobel Prize for the chemistry to isolation of the radium. And then her daughter, artificial radioactivity, Irene Curie, and her husband, Frederick Curie, got the Nobel Prize. 5 Nobel Prizes in one home. Amazing. Then so she came to United States to fundraise. She came to United States 18. She was a prolific fundraiser. She came to Waldorf Astoria, and then Louis Carnegie, Carnegie steel factories and all those rich icon. That what they did was they put a dinner meeting, and they raised $150,000, equivalent to $5 million now. I think $3-4 million now. President Harding personally accompanied her, and then she's a remarkable woman during the time. But mother of nuclear medicine, she Memorial Sloan Kettering Hospital, she adopted the radium thing and put on the tumor to decrease the tumor size. That's why still Memorial Sloan Kettering Hospital is still famous for cancer treatment. So this is the one they use the radium. They used to call radium hospitals actually. That is so nuclear medicine was born. She's a mother of nuclear medicine. 10,000 hospitals use it. Nuclear medicine, 40 million procedures a year they do. It's a functional medicine. You can see actually you use first chest thallium, or if you use a PET CT scan, you can see all these nuclear medicine effect. We can do great imaging through that nuclear medicine. It's a functional part. You can do functions. So she's a lone woman, genius woman, lone genius woman. Of all the people, she's the only one woman there. A lab was, the Life magazine, the journalist wrote, a lab was like a potato shed. So she discovered all these things. She cured the cancers, and she discovered all these things. Eventually, she died in 1934 with exposure to the plastic anemia because of the exposure to the long exposure to the radiation. Her body was radiating so much. They put the lead sheets around her body, and then they buried her in the Pantheon, one of the immortals of Pantheon in the France, in the Paris. That is like dedicated to the powerful people, politicians, and the kings. She was buried there, and she is immortal in that sense. So she really contributed so much. She sacrificed her life. And Smith College, when she died, Smith College, all the women's college in Chicago, they made her songs. They did songs for her. And then President Harding said that the great attainments in the realms of science and intellect, President Harding said that she is truly a remarkable woman. I want to bring her to a lot of people don't know much about her. That's why I created even the shirts she can wear, you can buy. So on my website and through Amazon. So, but anyway, thank you for watching. Let me bring Dr. Sanford to the table. Yes. What do you think? Just a little bit.
I learned so much. I thought we studied Marie Curie, when I was young, but I learned a lot. Thank you for that. Yeah, that's really inspiring.
Yeah. So you're inspiring. You're also inspiring. You're a speaker. We want people like that, to truly raise the voices. They never take no for answer. I want to go. The advocacy is that. So that's, you always have to keep coming back, Let me ask you, advocacy a little bit. Nurses burnout, advocacy, yes. It is really, nurses go through a lot of things. One of the things that happened in Tennessee. Thank God she didn't go to jail, but she lost license, unfortunately. Mm-hmm. So what do you think of advocacy required? What kind of things you need for nurses to do the right advocacy?
Wow, I tell you what, that is such a complex. That is such a complex question, really.
Yeah.
I was just at a think tank last month from some nursing leaders in the country talking about nursing burnout. And I mean, there are so many different pieces, to that puzzle. But really, I think it comes down to, at the end, it's really working together to get the systems to support the people, so that nurses and other healthcare professionals feel supported in what they're doing. And it of course, it's not saying a pizza party, right? Mm-hmm. It's the structures in place to really support staff, so that, because, the statistics are really staggering that nurses leave the field so quickly after obtaining their license, like 2 or 3 years. And what can we do to keep them there? I think, the biggest thing is, we have to there's so many things, like from an educator perspective, how do we support students so that when they're out in practice that they feel like they're contributing to good quality patient care. I think having systems in place to grow if people have a near miss or make a mistake so that they can grow through that. And then, of course, those safety measures, that's the things that I see as a legal nurse is that, nurses sometimes bypass the safety mechanisms. What safety mechanisms are in place? And are we training our nurses and our nursing students to do keep those mechanisms in place? And one other thing, even when I was at, of course, my love is talking about vitamin D deficiency. And so, nurses are vitamin D deficient. If we look at, studies that talk about nurses have lower levels of vitamin D than other professions.
There was a study done on them?
Yes. So we do shift work. Shift workers
Yeah.
tend to have low vitamin D, right? Because sometimes they're sleeping during the day or they're long shifts, so that they're indoors in the hospital. And, in a perfect world, wouldn't it be nice if every hospital had a rooftop garden for staff to go spend time in to
Absolutely
get outside? Really, if you look at, as I've traveled around the world, some hospitals have very nice gardens, actually. Yeah. But in the US, we're a little bit industrial now, trying to save money so that not all of our hospitals have spaces for patients and staff alike to spend time outdoors during the day. And so, that would be, if I was an architect, I would design hospitals with a rooftop garden for staff, right? Wouldn't that be a nice perk?
Actually, you are the architects because
yeah,
Florence Nightingale actually designed it. She was a,
Yep.
Scientific American wrote an article about how the first
Environment.
architect of the hospitals are Florence Nightingale. Because she was opening the doors at the time, all cramped
Yes.
quarters, and then there's no sunlight. She said sunlight is the healing power for a
Yes.
lot
Absolutely.
of wounds. Yeah.
Well, actually, she's her theory is one of the ones that I really loved when I was a student, and it really stuck with me. And a lot of people don't like it, and they said, "Oh, it's outdated or this," but really, she's talking about those core environmental components that help the patient to be healthy, right? She's talking about cleanliness, sanitation. She's talking about environment. She's talking about sunlight. She's talking about making sure that we have clean, fresh air. These things. If you think about some patients that are hospitalized for a long period of time, they're not getting any sunlight and they're not getting any fresh air, right? And it's really clean, because we're cleaning with all these toxic chemicals all the time, but we're not having some of those other components for the patient. And then, of course, you can't get UVB rays for vitamin D don't come through a window. You have to have special glass for that because glass blocks UVB rays, so you can't generate vitamin D from sitting close to a window, which some people think you can, and that's not correct. And so
I'm glad. Thank you for that information. I didn't know that.
Yeah. And so, you'd have to have a hospital with more expensive windows in order to have patients to be able to sit by the window to, get sunlight from that. And so if you look at some old hospital pictures, it's kind of interesting. They have full spectrum lights on the patient in the ICU to generate the vitamin D. Yeah. If you look back at some old pictures, I think that's interesting, right? And if you look back at, really old medicine, of course, I'm getting on a tangent talking about vitamin D again, but if we circle back to sun exposure, even nurses can benefit from more sun exposure in their life, because neurotransmitter production and regulation is related to vitamin D in the brain.
Yeah.
So the brain
that is a mental health wise is a very powerful, right? The green rays, Senator
and it's been studied a long time. The Brain Institute of Australia has studied brain chemistry, brain biochemistry, and vitamin D for 20 plus years. And so really, the research is really there. Yeah. We can use it for all sorts of things. And, I said, there's all sorts of suggestions. We can do this, we can do that. We can support nurses with, high-tech options. We can support nurses with low-tech options. Vitamin D is a very low-tech option. It's very low cost, very affordable, that if nurses all had robust vitamin D serum concentrations, guess what? Their neurotransmitters would be working better. That's what the science says. So that's a low-cost option. There we go. Everybody just got a free consultation. Get your nursing staff, get their vitamin D levels up, and guess what? Everybody's going to be happier and healthier.
There is a major research going on. Actually, former Senator Bill Frist, actually talking about greeneries around the hospitals, then how they can really, doctors and nurses can benefit by going through outside a green environment. And then it's going to be powerful mental. The burnout is a very anti-burnout, that kind of thing. It really helps the health professionals to do the outside, like rooftop place, or garden, rooftop gardens, or outside garden. Just walk around for 10-15 minutes. It is really
Absolutely.
powerful, they say.
100%. I mean, look at all the studies that say if we, they even tell us at work, right? Just for work productivity, go outside, walk outside for take your break outside for 10 minutes, come back in, get some fresh air and some sunshine, and come back, and it helps your productivity. It's the same for us working in the hospital too. Just think about our operating room staff. They're in little boxes all day long.
All the time.
I mean, they're at risk. I mean, they're at risk for even more decrease on exposure, because a lot of times, operating rooms are in the basement of the hospital, or you're in the inner part of the hospital where it's all enclosed. And so we really need to be thinking about our staff and giving them that space. Then what my students would tell me, Ramana, they would say, what? I don't even get to go to the bathroom during my shift. I don't even get to eat lunch during my shift. How am I going to have time to go outside?
Yeah.
Well, then that's a systems problem, right?
The systemic problem.
I mean, how in the world do we expect our nurses to be able to give medication safely, to be able to take care of patients, if they don't have time to eat and use the restroom during their break, during their shift?
Let us talk about that a little bit. ICU nurses, what there's a tremendous pressure on them, right? I was talking with Dr. Davis, Susan Davis. She talks about this, the pressure that go through the ICU nurses. That itself is it can cause constant pressure,
Yes.
can cause mental health problems, right?
Yes. I mean, nurses of a lot of different spaces of nursing have high pressure, very high pressure jobs. They're trying to take care of the patients. They're trying to take care of the family. They're trying to coordinate care with all the other healthcare professionals. It is a high stress job. I think, and it's something that we don't really talk about much, is that the nurse is really the patient care coordinator. A lot is relying on the nurse to be able to communicate and coordinate and take care of the patient.
Yeah.
And so, yeah, it is a high stress job.
Yeah.
And I mean, we look at burnout, and we look at, are we taking care of our staff? I had a staff member that needed a day off, and I knew she needed a day off. So I told her to take a day off. Yeah. And we shared her work, but she needed it. And there was no way that she was going to do a good job at work that day. No way. But that's not the norm, right? Like, I mean, we are understaffed consistently in nursing, but we can't use that as an excuse anymore for errors. We can't use that as an excuse anymore for, cutting corners on safety. We have to take care of our people so that they want to work for us. And that's really emotionally intelligent leaders who can understand all the moving parts. And then we need to take care of our leaders so they want to work for us too. Right. And, it's about, like you said, we have the inverted system. We have all the money at the top, and then the people who are working the long hours at the bottom.
Yeah.
And we need to balance that somehow.
We need to balance out. Let me ask you, I'm a Hindu, but I'm not promoting Hinduism here. But I want to ask you, a meditation yoga center right in the hospital system, your one room dedicated to the yoga meditation. Does it help, you think? What is without any my input from there,
Well, I was at a place that had a special room with massage chairs, that they could shut off the lights and relax. And the nurses really, really liked it. Yeah. And that hospital really did really make an effort that the nurses could go, and any staff. It wasn't just the nurses. That's just who I talked to about it. But when they took time to go spend even 10 minutes in there, it really did refresh them coming back on the floor. And so I do think some of those things are positive. It's not a whole all-encompassing thing, right? It's kind of an orchestra of solutions, right? And all these little bits and pieces can help make it, the orchestra sound beautiful, right? Sometimes when you have too much of one thing, you don't just only want to hear one instrument all the time, right? Like, don't give a pizza party every time something is bad, because otherwise people don't want pizza anymore. Right? Yoga doesn't solve all the solutions, but time to get out of fight or flight. I think this is the issue, is that nurses are in fight or flight all the time.
Yeah.
And so making sure that, nurses have high rates of addiction,
Yeah.
along with physicians as well, right? High rates of alcohol and substance abuse.
The last question, and we're going to the last minute. Doctors always advocates. Nowadays they're active about talking about prevention. Nurses been talking about for a long time, long before doctors, in my view. So they are the true advocates for the patients. Prevention is the key. Tell us a little bit. Let us talk about prevention and how that plays a role in the healthcare system, and how we need the advocacy for that.
Yeah, well, my doctoral specialty is public health and policy, so I'm really a advocate for up the pipeline solutions, right? I have been all the time. I mean, I grew up in a family where when we were sick, we were made to go sit outside, So I'm really, a really prevention-minded person, always have been, really into holistic therapies and anything we can do for prevention. And, I think it's very common knowledge in the US that we have a sick system. We have sick care, not health care. Around the world, there are other systems that have a better balance of health care, where they have insurance that maybe cover different therapies that can help the person to heal, instead of exclusively only covering pharmaceuticals, for example. I think that we definitely, I see a functional medicine person myself. That's who I see, because I want that holistic picture when looking at my health conditions, and when looking at my health. And honestly, my functional medicine provider, more than anybody else, has really gotten on me about the primary prevention things of, sleep, exercise, sunlight, reducing stress. There's nothing that kills us faster than high stress. Right. And so, making the choices in our life that if we can reduce stress, sometimes it's situational, but to have that long chronic stress is terrible for our health. I think it would behoove us as a society to move that direction for the up the pipeline solutions. And that's why I love talking about vitamin D. And people say to me, wow, like you talk about it a lot. I really do. Because I'm a book nerd, I have my nose in the literature all the time. And so I'm always sharing about new studies that I've read. I just messaged a friend of mine today talking about, I was reading an article from the Brain Institute of Australia saying that vitamin D is a hopeful therapeutic for spinal cord repair. And I was so excited about that. I'm not even a neuro nurse who works on a neuro floor, but I'm excited about that. You know why? Because I love people. And I want people to be well. And I want people to be at their maximum functional capacity. And in order to do that, we have to look at every solution possible. We have to get out of our silos. We have to work as a group.
So they can reach you, drbethsanford.com. I saw, I just put it in the bottom line. It's a truly an honor. You're a true warrior. We need warriors like you, Dr. Sanford. Really, we need the nurses like you, true warrior. It's an honor and privilege to have you on my podcast. If you stay a couple of minutes, I will talk with you after the podcast. But it's wonderful to talk with you. Thank you so much. It's an honor to have you.
Thank you. Thank you for having me.
Yeah. Good night, all.
We are retelling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it.